Okay. Hello, everyone. Welcome to the Autoimmune Registry Network webinar series. Uh, our focus on patient advocacy in our webinars is a foundation for sharing and exploring new innovations and knowledge. And this month, we have the pleasure of having a rock star. She's the president. She's a healthcare advocate. She's a community liaison and consultant. Good friend, Estela Mata, whose slogan, Knitting Community of Hope, is a foundation for Looms for Lupus. With that, Estela, it's all yours.
Well, thank you, Reggie. Thank you, Aaron, and the Autoimmune Registry for inviting me. I'm so excited and happy to be here with you all today with this amazing growing community of autoimmune disease, right? We are growing in numbers, and it's not always a good thing, but what I want to let you know is I'm excited to be here today. So autoimmune diseases, right? They're on the rise. They affect approximately 50 million Americans across over 100 distinct conditions, where the immune system mistakenly attacks the body. There are no two people that live with autoimmune diseases alike. And 80% of those impacted are women. Many live with multiple autoimmune diseases. These diseases are often underdiagnosed in minority populations. Due to these disparities in access to care and diagnostic delays, early diagnosis is critical to prevent irreversible damage and improve long-term access. Today, I'm going to be sharing about some personal experiences. Like Reggie said, I am an advocate, but I became an advocate because of a personal experience. These personal experiences that I'm going to be sharing are going to be from diagnosing to navigating the care to the daily challenges that we face while we're living with autoimmune conditions. I'm also going to highlight a little bit about advocacy, self-empowerment, and why collaboration is very, very important. And it can transform the way care is delivered. And I think more than now, we need to work together to be able to make a difference. So whether you're a patient, a provider, a researcher, or an ally joining us today, I hope that today's presentation leaves you feeling inspired to build a stronger partnership and to push for more inclusive and equitable care. We need this in our autoimmune disease community. We need this overall in our communities. So let's get started with the presentation. Can you move to the next slide, please? A little bit about me. I'm Estela Mata, like Reggie said, President and CEO of Looms for Lupus, a nonprofit organization that was created to provide support, education, awareness, and advocacy to those living with lupus, overlapping conditions like fibromyalgia and mental health. We serve not only the patients that live with these conditions, but also the caregivers, the loved ones, and the community as a whole. I'm an ambassador of hope for Mata advocacy and support, and a founding member of OLA, an organization for Latino health advocacy. So, yes, I said this earlier, I am an autoimmune disease patient. I am a healthcare advocate. And I like to be involved in many things, involving advocacy, involving research, and involving community. But this is not about me, right? This story is not just mine. It's about someone who inspired and ignited that advocate in me. So let me introduce you to my sister, Juana. Next slide, please. Juana is my older sister. She's right here next to me on this picture. She's the one wearing the brown blouse. You see, in 2009, something life-changing happened to us. My sister Juana nearly lost her life due to complications from an autoimmune condition that we didn't even know existed back then. Her symptoms were severe. There were painful mouth and nose sores, joint pain, rashes on her scalp, on her face, on her body, hair loss, bruising, petechia or small little dots all over her body. See, some of these symptoms were visible, some of them were invisible, but they were very concerning. See, she had lost someone that had died of leukemia recently to 2009, and a lot of the symptoms, mirrored those of her friend. And so she was concerned. She went to the urgent care and, insisted that she was treated. They told her, go home, come back the next day. She called me and she said, sister, they don't want to see me. They're telling me that they're going to get labs and for me to come back the next day. I've worked in healthcare for over 30 years, so I knew that there was something wrong with her. And I knew that she needed care. And I knew that if she left, she wasn't going to get that. So I told her, stay there and continue asking for labs, stat labs. And stat means like now, like let's get them done now and let's see the results now. So she insisted, she persisted, and it was then when she was diagnosed with lupus, an autoimmune condition we knew nothing about. You see, her platelet count was at 6 when she started, when she was first there and she had the first lab draw. By midnight, they were at 2 or 2,000. And I think normal is about 130,000 and above. She was dying. If she would have gone home that night, she would have died. So she was diagnosed with lupus, and she was admitted to ICU and fought for her life for 7 days in the ICU. You see, back then, there was not a lot of information about lupus. We didn't even know what it was. All we knew was that it can kill you, that there was no cure, and back then, no FDA-approved treatments. There was no support. There was no information available. My mom only speaks Spanish, so there was no information for us, and there was absolutely no information for her in Spanish, in the language that she understood and spoke. See, Juana's journey revealed just how complex and overwhelming getting a diagnosis could be. And what can happen if you're not diagnosed early enough, right? But also the complexities that being diagnosed with an autoimmune disease can be. So let's talk about what patients face when navigating these conditions, because it's not just about managing a diagnosis, it's about managing life, because an autoimmune condition doesn't just impact you physically, but it also impacts you emotionally. And life doesn't stop because you are now diagnosed with lupus. You see, my sister, Juana, is a social worker. So she needed to continue living her life, continue working. She had 2 kids back then that were young. She had a family. She had a lot of things going on for her. But she also now needed to take charge of her health and needed to learn how to navigate her journey. But the one thing that she knew when she started, even though she didn't know much about lupus and we didn't know much about what an autoimmune disease was, we knew that she was the CEO of her body. She knew what was wrong with her. She knew what she needed, and she needed to make sure that she was involved with everything that she needed to do for her care. So many patients wait for years for a diagnosis. I think for lupus, it takes approximately 2 to 6 years to get a diagnosis. Sometimes you need to see different specialists before anyone can connect all these dots. Once diagnosed, yay, you're expected to become care coordinators, symptom trackers, and treatment advocates overnight. Not even overnight, like right away. As soon as the doctor tells you this is what your condition is, you need to step it up and start navigating your care and become an expert. You see, navigating care means a lot more than just the words navigating. It means preparing for these doctor visits. It means writing down the right questions, making sure that those questions that you have get answered and that you understand those answers. It means managing unpredictable symptoms, symptoms that are new, symptoms that maybe you've never heard about or experienced. Making lifestyle changes such as exercising, eating better, sleeping better, and managing your stress levels, because yes, stress can trigger a flare with these autoimmune conditions. It means engaging in that shared decision-making and adhering to these treatments and these complex treatment plans that sometimes are offered to you. All this in the middle of juggling all these appointments across multiple specialists, because with autoimmune conditions, it could impact, different things. And I know with lupus, my sister has to navigate through so many specialists, from the nephrologist to the gastroenterologist, and all the ists in the list goes on and on. So you need to be able to juggle and manage all of that. And this is a reality, not just for Juana, not just for me, but for many patients that get this diagnosis of an autoimmune condition. It's very difficult, but we want to make sure that you know that you're not alone. These impacts of these autoimmune conditions are great. They're big. But I know that with advocacy, with education, with support, we can manage our care and be hopeful for the future. And in the face of all these challenges for us, for Juana's journey, one thing became clear out of everything. Self-advocacy is not optional. It is life-saving. Next slide, please. Yes, my sister is alive today because she advocated for herself, because she did not take no for an answer, because she spoke up. And that's what we all need to do. Whether you're diagnosed with an autoimmune condition now, whether you're seeking to get a diagnosis, we need to learn to speak up. We need to learn to look for more options, because patients are the experts in their experience. Self-advocacy is essential. It begins as soon as you think you may have an autoimmune condition, or as soon as you have the diagnosis. You need to start learning about your condition. You need to start learning and understanding about the treatments available to you. You need to be an active part of your care team. You need to be able to ask the questions. You need to be able to communicate openly with your providers and make sure that your voice is heard. You need to seek support from trusted networks and know that you have rights as a patient, as an individual, as a human being. You need to include also learning about the healthcare system, because boy, it is very difficult to navigate at times. You need to learn about appeals, how to appeal these decisions. Sometimes when you get denied care, you get denied treatments, prior authorizations and all of that. You need to explore all these options. that you may have, whether it's seeking a second opinion, whether it's a new therapy, whether it's participating in a clinical trial that may be all the only treatment option for you at that time. We as patients need to advocate for ourselves. And if an individual or a child cannot advocate for themselves, then you have the caregivers and the loved ones that can help advocate for their loved ones. And navigating our care is a little bit difficult, like we said, but self-advocacy, using your voice, asking those questions, preparing for your doctor visits, and not always accepting no for an answer is the key. So Juana's strength and her voice inspired us to take action, not just for her, but for everyone facing similar battles. And so her advocacy story is shared amongst all the people that we know. Why? Because we know that a story is very powerful. So I want to show you what, on the next slide, how Juana's journey ignited our mission and how I became an advocate and why we do what we do. You see, Juana not only was living with these autoimmune conditions that were impacting her physically and mentally, it was impacting all of us, right? We needed to figure out a way on how to cope. We needed to support each other. We needed to support and raise awareness about this. We didn't want anybody to feel alone. We would gather together to loom knit. She started loom knitting as a coping mechanism. This is where the name Looms for Lupus came about. We wanted to knit a community of hope. We wanted to empower the individuals. We wanted to let the people know that they were not alone. We wanted to support. We wanted to empower. We wanted to educate and advocate for those living with these conditions. But we didn't want to just stop there. We wanted to also advocate for the caregivers and loved ones because we all need to support one another. And everything should be delivered in the language that people understand, right? So we didn't want to stop. We did not want to just stop there with creating an organization. We wanted, and we still want more change. And we want to raise more awareness. And I'll show you what came out of Juana's story, Juana's journey, and us advocating and creating Looms for Lupus. Next slide. Looms for Lupus is a nonprofit organization. We're pretty small. You might think, what impact, what change can we do? As an individual, you're living with a condition, you're trying to just navigate your care, why add on something else to your plate? Well, you want to do that because you want to make a difference, because you don't want anyone to feel alone. You don't want anyone to navigate this journey alone. So I'm going to take you through our journey, and I'll tell you a little bit of stories through these pictures and collages that you see. So the first picture up on the right, left-hand corner, looking at my screen, is Juana. And then there's a little girl next to her. And she's loom knitting. And under that, you see me. I'm also loom knitting. And then you see Ruth. She is a licensed clinical therapist. That's one of our first support groups. See, we incorporated loom knitting as a coping mechanism, as a strategy to learn how to include different psychosomatic ways and stress relieving techniques to empower the individual to relieve stress and not focus all about the disease. And so within our support groups, we incorporated different tools, different workshops, education, and all of that. And I want to take you back to that little girl that's next to Juana. That little girl is my daughter, Isabella. Yes. She attended our support groups. She would sit quietly in the back after she would, knit, or if she would get tired. But she listened, she learned, and she put what she learned into action. She began tracking her symptoms, what helped her, what relieved them, what made them worse. How these symptoms that she was dealing with at a young age of 13, how they impacted her daily life. how they impacted her school, carrying books, studying, running. Because of all of the awareness and all of the things that she learned during our support groups, she was diagnosed with fibromyalgia at the age of 13. Now, why do I share this? I share this because sometimes you don't know who you are helping. You don't know that what you are sharing can help those people that are listening to your story or those tools that you're providing, and how you can impact their lives to getting an early diagnosis. I want you to look down at the picture below where you see Juana smiling, you see me in the middle, and you see two young girls next to me. And behind us, we're in Washington, D.C., the Capitol building. That back there with a smiley face is Isabella. She's my daughter. And next to her is Cassidy, my other daughter. So it's two sisters supporting each other. I'm there with my sister. Cassidy's there with her sister, Isabella. It is the first time that she advocated in DC, shared her story and her journey about living with fibromyalgia. She asked for more research for fibromyalgia, and she also advocated for mental health. You see, it is about a journey, about working together, supporting one another, and making a difference. Next to us, next to that picture, you'll see, next to the picture, you'll see another picture of Juana and I. You know, we're advocating at our Capitol here in Sacramento. Right above that picture is us standing outside in DC. That was our first time we went to advocate for more research for lupus and also for more policies that impact patient care. And if you go next to the last picture, you'll see Assemblywoman Rubio handing a certificate to Juana. That's for our community event, our 5th annual wellness day, which Reggie from Autoimmune Registry attended. It's a community event where we engage all stakeholders. We include legislators, patients, providers, community, researchers, and we include everyone to work together, learn, and feel empowered, because we have to do this together. We need to empower each other and be there for each other. And down below is a picture of us at a mental health awareness community fair, and we're providing resources and information. And why do I share all of this collage? Because when we empower patients, whether it's in a support group, giving the tools to children, to families, to individuals that live with these autoimmune conditions or their loved ones, we are offering resources. We are offering connection. We are offering hope. And all of this empowers the patient, the individual, to speak up, to find support, and to advocate not only for themselves, but for others as well. So advocacy isn't just something that we do alone. Even though I've showed you pictures of us in action, it's not something we do alone. It takes a collaborative effort. It takes collaboration with providers. It takes collaboration with researchers, with legislators, and organizations working along this journey with us to truly make a difference. These collaborative partnerships are key. Whether it's a patient and provider partnership where the provider promotes the shared decision-making and builds that trust with the patient, and those providers listen to the patient, validate the patient, and make the patient experience great. This allows the patient to feel comfortable, to feel empowered, to speak up, and to ask the questions that they need, and to be part of their care, and be part of that shared decision making together. Patient advocates and research collaboration. We need to include patients as co-creators in research. We need to include patients in building tools for more patients. A great example of this, and I'll talk about it a little bit later, is the All of Us research program and how inclusive they are and how diverse they are when it comes to trial design and data use. All of these collaborations are important. Community and peer support networks. These support groups, these bilingual workshops, these mental health sessions, the peer-led education, the techniques on stress management, all of this builds trust and reduces isolation. So these collaborations are essential. And I'll give you an example of that. So Looms for Lupus provides bilingual support groups, right? We're I think there's only one other organization that provides a Spanish support group and a bilingual support group. You know, we could have done it alone and said, okay, you know, we're the only ones that do this. Let's do this, you know, promote it ourselves or help as many as we can with our reach. But instead, we work with other organizations that don't have a Spanish support group. And we tell them, here, we have the resources. This is when we host the support groups. Please send people that need a support group, whether it's virtual or in person, send them over. We're here to you. We're your extension of a support group. We will work with you. That's what community and peer support networks do. Cross-organization collaboration. Like I said, we can't do this alone. Many organizations are doing amazing work in their autoimmune disease space or with a specific condition, and they're making big impacts. But why are we not working together? We need to start working together. We need to start collaborating because these partnerships and collaborations lead to real tools that will help patients navigate their care. So let me show you a few examples on how Looms for Lupus collaborates and what it looks like when these collaborations happen and the impact that they make and the impact that they have on patients. So this first example is a lupus toolkit. This lupus toolkit is a toolkit for care coordination or coordination of care, however you want to say this. It was created by the Society of Women's Health Research, an amazing organization, and they reached out to us, and they reached out to many researchers, expert rheumatologists, organizations, and patients. They had Juana as a patient, Ayana a patient, and myself as a caregiver loved one. This toolkit was created for the first time ever for free for the patients. It is downloadable. Researchers actually could access it. Providers, rheumatologists. When we attend the American College of Rheumatology, we had so many rheumatologists download this toolkit for their patients. You know, why did we do this? Because we needed to create a toolkit that everyone could use, that the researchers, that providers can give to their patients, that patients can utilize. So this is a great way of showing the impact that we can make when collaborating or when different organizations are collaborating together, creating these tools. So there's a link here, and we could probably share it also in the chat later on how to download it. It's free. It is downloadable. It has many amazing tools that cover symptoms, care coordination, mental health, advocacy. And again, this wouldn't have happened if we wouldn't have worked together to create something useful for our community. Next slide, please. Another example of a tool that was created through collaboration, right? This impact pain tool. Now, September is Pain Awareness Month, and many of us that live with autoimmune conditions, whether it's lupus, rheumatoid arthritis, and the list goes on. One common symptom is pain. Even people that don't have autoimmune diseases could suffer from pain. So pain is universal and it crosses over the borders. So this collaboration actually expanded a little bit more than the United States. It was a collaboration with other global organizations. So Dragon Claw is an organization in, I believe it's in Canada. There you go, in Canada. And this other organization called Pain Australia from Australia got together and got patients together to create a pain tool. And this pain tool was developed through this global partnership. And part of those patients, or part of the groups, were patients, nonprofit organizations, patients that lived with different conditions, autoimmune conditions, or just were living with pain. I was one of those patients. I was one of those that contributed to the creation of this tool. And this tool was created to empower individuals with chronic pain to track symptoms and communicate effectively with providers. So, many times, when we go to the doctor, we say, oh, I've had pain, for 2 weeks, and we don't describe the type of pain we're having. Maybe, there's so many things in our mind, we don't describe it to the point where it can make an impact on the provider, right? There's only 15 minutes that you have with a provider, and, pain may not take the majority of the time for you. So let's create this tool that will help you put it all together. Do it before you go to your doctor, and you want to include that, pain has been, a big part of your 3 weeks since you last saw him. The pain has been impacting your life, in a very crucial way. It's, impacting the way you live, the way you work, and everything in between. But you can't just do it by letting them know that you have pain or you're experiencing pain, right? So you need to be able to describe the pain, to let them know what is helping that pain, how long you've had the pain, what kind of pain you're feeling. Is it a stabbing pain? Is it a burning pain? This tool is going to improve the communication that you have with your provider and help address the pain and possible treatments. So very, very important for us to be able to describe our pain, to let the providers know what's helping, how it's impacting you. When I go in and I talk to the doctor, and if I'm having a lot of pain, I tell them my pain in the morning is so debilitating that I can't get out of bed, that it takes me 10 minutes to get out of bed, that I can't wash my hair when I'm showering because I cannot lift my hands beyond the here. You see, I have fibromyalgia and arthritis and rheumatoid arthritis and polyarthritis. So me describing the level of pain can be pretty significant as to how and he's treating me, right? Or these providers are treating me. So these tools are not just tools that are created, right? They're tools that we want patients to utilize. We want patients that need these tools to get the most out of these tools. And that's why we want to continue to create tools, create these collaborations, because we need to continue to keep patients informed about these tools that are there to help them. And just like helping them with these tools and having these tools accessible, like the Lupus toolkit and this tool impact pain tool, we also need to keep patients informed and the community informed about other patient opportunities or treatments or opportunities that they can participate in. So another example of how we have been collaborating is our next slide. So, and maybe you've heard of this, maybe you haven't, but clinical trials is something that many people have not heard about. Many people don't understand what a clinical trial is. Many people don't participate in clinical trials because they are afraid. So there was an FDA Take Charge campaign that was initiated by the FDA and the NIH many years ago to raise that awareness and bring that information to patients and to empower the patients, especially from underrepresented communities, to make informed decisions about their options in care, and not just including the treatments that are available by, or given by the provider, but also options about participating in clinical trials, because maybe sometimes clinical trials are the only path to treatment for many patients. So it's important for us to highlight the opportunities that are out there for patients. And so this collaboration highlighted, one, the importance of representation; two, the power of patient voices; and how we shape the future of care. So Juana was able to share her experience about participating in clinical trials, because remember, when she was diagnosed with lupus in 2009, there were no FDA-approved treatments. So we needed to look at more options that were out there besides the borrowed treatments that she had. And so when patients are included from the beginning, science becomes stronger and the care becomes more equitable. So when all of this comes together, you have informed patients being part of the process, you have patients learning about clinical trials and the opportunities that clinical trials can bring to them, then everything becomes more cohesive, right? And so these collaborations, these inclusive partnerships are very, very important. Next slide, please. So inclusive research, the inclusion is what I've been talking about. So these collaborative partnerships don't just create the tools that the patient needs. They also open the doors to research, to data, and to innovation. When patients are part of this whole process, we can move from having isolated care to more informed care. That is why registries and clinical trials are so essential. They help us understand autoimmune conditions more deeply. And if we're starting at the top, we need to start with patient contribution. Patients being included, participating in registries, participating in clinical trials, participating in studies. We can share our data through surveys, through biospecimens, through our lived experience. Registries and research, we can have our data that we're contributing analyzed to identify the patterns and gaps in care that we may need and that we may need to focus on. All of these clinical trials and innovation is what we need. We need the insights from these informed trial designs to be included and to also help develop future therapies. So it's all connected. And then to tie everything in is our care, right? We have community-led empowerment support tools that are going to help us improve our care, that are going to empower us to be part of all of this. And why do I bring it all together? Because we need to have this data ecosystem available for all of us in the future. And before I dive in to some real life examples of the types of inclusive research that are happening right now, I want to share something personal. I live with an autoimmune condition, like I told you before, and navigating care hasn't been easy for me, even though I've been in the healthcare system for 30 years. That is why this work means so much to me. I'm not just an advocate. I'm a patient. And inclusive research isn't abstract. It is about real people, real lives, and real change. And so when we're looking at all this together and how it all connects together, we need to think more about including everyone and partnering and working together. So I'll give you an example of what this inclusive research looks like. If you go to the next slide, we can see all of this come to life with this amazing example right here. The All of Us research program that is led by the NIH set out to build one of the most diverse health databases in history because it's personalized medicine, right? It can't happen without representation. So Juana and I are actual virtual advisors. So they've included members of the community to be part of this. And we are part of it because I don't know if you knew this, but 20% of the US population, or almost 20% of the US population, is Hispanic, and less than 1% participate in clinical trials. So for us, visibility was a thing. We needed to make sure that we represented our communities. Now, on the other hand, you have the Autoimmune Registry, which brings this all together. The Autoimmune Registry collects data across over 150 autoimmune conditions, and it's using all of us data to uncover treatment patterns, comorbidities, and how socioeconomic factors shape care. This right here is a beautiful example, a powerful example of how inclusive research isn't just a concept. It is a movement driven by patients at the top, not at the center, at the top of it all. It's where us as participants, as patients, share our data that can be utilized by these registries like the Autoimmune Registry and make a difference for future generations. Now, inclusive research is powerful, but real change happens when we bring it back to the community. So I know I took you through a journey and I want to bring it back. So next slide, please. I want you to advocate. I want you to use your voice and to make an impact. Whether you're a patient, a caregiver, a provider, a researcher, this is your invitation to take action. Advocacy isn't just about raising awareness. It's about action, connection, and lasting change. Congress fiscal deadline is today, September 18th, and we must act now because we need more funding for research in autoimmune diseases, in women's health. And I want you to do these things. Write to your representatives, share your story, and begin collaborating because, again, together we can make a difference. And I know that we've seen so many things in my presentation today. We've seen how self-advocacy can save lives, how partnerships can build tools that truly empower the individual, and how inclusive research can help shape the future of care. But none of this happens in isolation. It takes all of us, the patients, the caregivers, the providers, and researchers working together. And that's how we build trust. That's how we drive progress and create community rooted in hope. These are all real-life examples of inclusive research and action, from national campaigns to patient registries, from my loved ones' personal journeys, and even my own journey of living with an autoimmune condition. When patients, programs, and data come together, we don't just advance science, we build equity. So thank you for being part of this journey and for allowing me to share a little bit, because I know that together we are knitting a community of hope.
Estela, what an inspiring presentation. Truly felt that. Do we have any questions? Yes, I think my opinion is shared by a lot of the attendees that we are all in this together, and from caretakers to patients to leadership organizations that
So
are
I'll
committed.
start with a question.
Go
Um,
ahead, Aaron.
Estella, I saw you were you're working with scripts. Can you tell me more
Yes.
about I mean, that's very impressive because I think that's where you can really have impact is when you're actually working with health systems that are delivering care. Can you tell us more about that?
Yes. So both my sister Juana and I are virtual advisor team members for the All of Us research program and the Scripps Digital Therapeutics program. And
Oh, so
so
that's their all of us
it's
group.
separate. It's a little bit separate.
Okay.
So the Scripps Digital, there's actually a study that I am part of. So not only am I an advisor, I'm also a participant. So we have wearables. So during the during
Hmm.
COVID, the COVID era, right? And the COVID, we're still living it, by the way, because we're all still impacted. But during the beginning of COVID, a lot of us had many complications after COVID, after we, recovered from COVID, if that's what we call it, right? After not being positive with COVID, we had what's called long haul COVID.
Right.
And so I was one of them. So I became part of the study where they gave us a Fitbit and it would kind of track our sleeps, our like sleep studies, our heart rate, and it would monitor a lot of data. And it also included surveys and about mental health and the impact that, isolation and all of that cost. So all of this data is gathered together, and now we're able to know that long COVID does exist. So with participating with studies like this and also talking about it, it's very powerful because you get to be able to not only impact the rest of the community, right, but also help yourself. It helped me navigate my care. Being able to see that my heart rate was like at 120 when I was sitting down is not normal. I was not exercising. And knowing that my sleep patterns changed and were going to impact my autoimmune condition also helped me navigate care. So being part of these studies, being part of registries, being part of all of this is really, really important.
How did you get involved with them? Did they reach out to you, or how did you find out about them?
I actually learned about it through my sister Juana. She was like, hey, I participated. I heard about this All of Us research program. They're enrolling, 1 million people to make a difference. And I was like, okay, so what does it do? And so what do I have to do? And so you basically just sign up, and everyone has different reasons to doing this, right? For me, I wanted to make a difference. I want to make a difference. I want to give my information. I don't need anything in return. And the reason I do this is because in my family, we have autoimmune diseases that we didn't even know about, autoimmune conditions that are passed on to generations ahead of me, to my children, to my grandchildren, to my great grandchildren, and beyond my life, right? So I want to make a difference for future generations. So to me, being able to participate, being able to give my data, being able to give my specimen, being able to contribute makes a difference. So it was what is it? I did not have to think about it twice to join.
So I joined the program as a participant as well, but and we started using, of course, the Autoimmune Registry started using the All of Us program early on, and I'm on the advisory panel as well. Are you on the advisory panel?
I'm on several advisory panels.
Okay.
I know that the data that they're utilizing or the data that they have is being utilized by other researchers and registries
Yeah.
like yours. It is very impactful to know that something that we contributed to is now also helping the autoimmune registry and helping autoimmune
Hmm.
patients with
Absolutely.
autoimmune conditions. So it's a collaboration that even though we may not see it, it's all interconnected. And at the end of the day, it is about the difference that we are making. And for me, it's very easy. I will collaborate, I will join, and I will do what I can in my power to help others because that's really my purpose.
If if anyone else has questions, raise your hand or put it in the chat. I do have one thing to add. We're running,
Yes.
coming to the end of the hour, but I want to talk briefly about an opportunity that the Autoimmune Registry has been working on. That it's still early days, but at this point, we are trying to create a meta registry. And what that is a database that has information about all the databases that are out there. It's a way to find out where the data is buried.
Mhm.
So if any of the people on this call, if your group collects data on from any kind of data from patients that's related to an autoimmune condition, please email us. We're going to be reaching out to our network, people who are just interested, as well as people who are officially in the network, to find out how many participants you have in your registry, what data have you collected from them. Breakdown of men and women is always helpful. And that's going to be that's all we need. We just need to know what you've collected, so we know how many people have demographic data, for example. And this could lead to some funding opportunities. That's what we're hoping. So, any other questions before Reggie winds up?
I think that's amazing, Aaron, that you bring that up, and it's important for our community to know and learn about this too, because you may have someone that's here right now listening to what we just talked about and what you just shared about collecting all the data and trying to make a hub of all the data, that repositories that are out there. But we may not know of everything that's out there. So putting it out in the community, maybe, talking about it and saying, the data that you are giving can be utilized by us. And this is the impact that it's going to make. Because when you make it personal, it makes such a big difference. Not everyone wants to share data. There's so many people that are afraid to share their information, to share their data. Who's getting their data? Is it getting sold? Like, how is it being utilized? So I think it's so important to start talking about, what do you mean by collecting the data, and what are you going to do with the data, and the type of data that you're collecting, and what is going to be the outcome of what you're doing. And then once you get there, let people know how their data was used. And I think that's
Yeah.
like the loop, closing the loop, and a lot of things that sometimes don't get, back to the patients or the community members, because we would be more willing, I think, to participate, to contribute if we knew and we were included in the big picture from the beginning.
Great. Thank you so much,
That's
Estela.
wonderful.
It's been amazing.
Thank you
Amazing
for
story.
everyone for the attendance, Estelle. Wonderful world of wisdom and Autoimmune Registry. We do comply with that, making sure community involvement and the protection of the important data that is shared with us. We understand that responsibility. Forthcoming for the month of October, we will have Dave Walton, CEO of T1D Exchange, who will be speaking on type 1 diabetes and all the wonderful things that are happening in that space. And in November, Estella had talked about pain. We have the luxury of having Nicole Hemingway, who's the CEO of US Pain. So we will do our best to answer and be good stewards of your time and making sure that we are providing the benefit to everyone. So with that, thank you. And I will wrap up. See you next month. Thank you.
Thank you very much, Estella.
Thank
Thank you,
you.
Reggie. Bye-bye.
Bye.